Welcome to the Sip and Say It podcast with your host, Carlos, a.k.a. Los, a podcast that promises to deliver a raw and unfiltered experience as we dive into the one-on-one conversations about a wide array of topics. We're inviting listeners to engage in candid discussions, personal stories, and diverse perspectives. Say what's on your minds. Let's create an open space for honest dialogue. As a village, let's immerse ourselves on trending issues, personal anecdotes, thought-provoking themes. Nothing is off limits. Tune in and become part of the conversations. Let's sip and say it together.
Hey people, how's it going, man? This is your boy Los. Welcome to Sip and Say It, man. Sip and Say It. And as always, my partner in crime.
This is Kevin, aka Kev.
That's right, people. So listen, we're doing a little bit of a PSA. We know what this month is all about, right, Kev? What's this month again now?
Well, considering all the pink I see everywhere, that would be Breast Cancer Awareness Month.
Right now, I think it's the right thing to do. As much as it's being publicized out there, the importance of putting this PSA out there to all our beautiful women and, believe it or not, Kev, men.
What?
Yeah, man, men. So, without a shadow of doubt, man, I'm gonna let you roll this out.
All right. So I'm going to go in here. We're talking about breast cancer. We're going to do some busting breast cancer myths. And we're going to talk a little bit about what breast cancer is. Now, I want to say that these are not our opinions. We have pulled this information from different sources, including the National Breast Cancer Foundation. But I'm going to start with what is breast cancer? Breast cancer is a disease in which malignant cancer cells form in the tissue of the breast. Cancer is a broad term for a class of diseases characterized by abnormal cells that grow and invade healthy cells in the body. Breast cancer starts in the cells of the breast as a group of cancer cells that can invade surrounding tissues or spread or metastasize to other areas of the body. Now, one of the key factors about breast cancer is the most common type of cancer in women, excluding skin cancer. It's also the second leading cause of cancer death after lung cancer. About 1 in 8 women will get invasive breast cancer in their lifetime.
Yeah, you know what, Kev? I was when we were doing a little bit of homework on this. It did say that one in the United States, 1 out of 8 women eventually get diagnosed with breast cancer, and I'm probably putting the carriage before the horse, but you know that right at that you hit that 40-year mark, 40-year-old mark. Those when it's the important time to start getting some mammograms done, right?
Yeah, it's real important.
So I guess we're about to talk about the importance of the awareness and early detection and the 3 steps to early detection, right? So I'll kick off step 1, right? So breast self-awareness. First step is practicing an early detection is developing breast self-awareness. Knowing how your breast normally looks and feel is also called breast self-awareness. This will help you identify any changes, abnormalities in your breast that should be reported to your doctor promptly. You should know the geography, I can't even talk right, of your breasts better than anyone else. And I think that it's not only for our beautiful women out there, but also us men. And I'm sure we're later on into this conversation, you gentlemen are also going to hear a little bit about how important it is for us to, you know, sometimes we're so, let's just say knuckleheads that we don't really pay attention to certain things like that. And if I'm right, Kev, correct me if I'm wrong. Us men don't know until later on in our years.
Yeah, because it doesn't show up until later in life. But we'll get to that. We're getting ahead of ourselves here.
Yeah, my bad.
Step 2, well woman exam. I kind of wanted to go back to step 1, and I don't want to make lighthearted of this, but since we're talking about the topic of breasts, men, while women should know the geography of their breast better than anybody else, let's be real. You guys should also know the geography of your woman's breasts. So make sure you also help to check her out. So step 2 is well woman exam. It's recommended that women visit their family physician and or gynecologist every year for a well woman exam. In addition to a routine pelvic exam and pap smear, the doctor may perform a brief breast exam to check for abnormalities. This breast exam is commonly called a clinical breast exam. The Well Woman exam is a great opportunity for you to discuss with your doctor any questions or concerns you have regarding your breast health. For example, your doctor may help you determine the most appropriate personalized frequency for your early detection steps, such as how often and when you should receive a mammogram, or other types of breast imaging studies, such as an ultrasound or breast MRI.
And that'll just take us to step 3, is the actual mammogram itself. The mammogram is an x-ray of the breast, right? A safe way to detect cancerous tumors and other abnormal breast conditions, oftentimes before any symptoms appear. So mammograms can detect cancer or other problems before a lump becomes large enough to be detected by touch. And that's probably uh, one of the important things is just getting these exams where you don't, you get that early detection
Hmm.
and God forbid your significant other, girlfriend, mom, aunt, sister, whoever it is, find a lump. Because the moment you find the lump, man, I would hate to even sit there to imagine where their minds are going quickly.
Right.
So they provide an effective way to find breast cancer in its early stages when treatment is usually the most successful. So mammograms are considered safe, quick, and relatively painless. Even though I think I've heard,
I've heard too. I would hate to have one because I heard it's like they pancake the breasts.
yeah,
It doesn't sound fun. That
yeah. And I apologize. We should have
a
a
female
female here with us
perspective,
speaking
yes.
about that. But obviously, our PSA is out of respect for all women that are experienced or have experienced or gotten a scare
Yeah.
in this situation, right?
Yeah, because I was reading that 50% of women will discover some type of lump in their lifetime.
Mm.
So that's got to be scary to have one and not know, what to do next.
So let me wrap up step 3. Women who have screening mammograms have a lower chance of dying from breast cancer than women who do not have screening mammograms. So yeah, it's something to really, you know, kind of dive right into is knowing the difference, right, Kev?
Yeah, like what is a screening mammogram?
So those are routinely performed to detect breast cancer in women who have no apparent symptoms. Sorry. These are commonly referred to as your annual mammograms.
Okay.
So diagnostic mammograms are in more depth and used if suspicious results are found on a screening mammogram or if some abnormal signs are found by you and or your doctor. It is also recommended that women ages 40 and older get a mammogram every year. However, if you have a first degree relative who has breast cancer, you may need to begin receiving mammograms earlier than you're 40. And I think I have heard that, right? Like some stuff could be hereditary,
Hmm.
and the more likelihood that um, you have a family member, significant other, um, experience or be diagnosed with that, the chances of you, I don't even want to say the percentages of, but it is absolutely recommended to go start getting exams early.
Yeah. I think there's a math equation in there somewhere that I read.
Hmm. All right. So typically you take the age of your relative's diagnosis and subtract 10 years, giving you the approximate age you should begin screening. So I
Oh,
think that's our mathematical
okay.
process. So let me give you an example. If a first degree relative is diagnosed with breast cancer at 45, You should discuss beginning mammogram screenings at 35 with your doctor.
Wow. See, I didn't know that there was some type of math that should be done for that.
Yeah, I mean, listen, the chances of something like this appearing, I'd rather play it safe than sorry,
Absolutely.
right?
Absolutely.
So, our next approach to this is all the myths about catching or being diagnosed with breast cancer. So let's dive into that. I mean, what's give me something, Kev.
All right. We're gonna do some top 10 myths. And no particular order. There's not one more important than another. But myth one, something I've heard before is only old people get breast cancer.
Yeah, definitely not, man.
Yeah, fact is, breast cancer can affect people at any age, even sadly, children.
Wow. And think of your children. Mom, dad, most of the time mom, because mom is taking care of the kids. Um, and we do have those parents that share those responsibility, but a mom knows their child head to toe,
Mm-hmm.
head to toe. So I'm gonna jump right into myth number 2. I'm too young to worry about breast cancer. Whoa. Fact is, while most cases are diagnosed in women over 50, it is essential for all ages to be aware of their risk factors, right?
Oh, yeah, absolutely.
And more importantly, again, if that first degree relative has been diagnosed with, then man, your antennas, spidey senses, whatever you need to call it.
Mm-hmm. Do that math, get protected.
Yep,
Absolutely. Yeah.
absolutely.
All right. I'm going to roll into myth three then. Breast cancer only affects women who have a family history or certain genetic predispositions.
Hmm.
Fact is, many people with no known risk factors can still develop breast cancer.
Yeah, I guess you don't realize what things you've been exposed. Our bodies change.
Yeah.
Um, you know, we could go up and down in weight. Where we work at could plague, a condition or some sort. It's it goes without saying, man, that you have to stay on top of it. Get those annual checks and make sure we check that out. So myth 4: a breast injury can cause breast cancer.
I've heard that one.
Yeah, and you know what I think is again that it is a myth, but injuries to breasts do not cause breast cancer. Injuries caused by a car accident or a blow to the body, for instance, can lead to pain, bruising, or bleeding, which may result in a buildup of blood in the breast area. But that's known as a hematoma, right?
Mm-hmm.
Additionally, fat necrosis or scarring of the breast tissue can occur following an injury, surgery, or biopsy. Generally, these injuries will heal on their own, with time. If you are having a mammogram performed following an injury, however, this may entail additional imaging. So let me backtrack and repeat that portion. Generally, these injuries will heal on their own with time. And if you're having a mammogram performed following an injury, let's make that as a question, right? But it really is. This may entail additional imaging, right? Like they need to go deeper.
Oh, right. Because they have an injury, they're going to get looked at and inspected. I see where you're going with this.
They're going to have that hematoma,
Uh huh.
and that hematoma could block what needs to be seen, right? So
Right.
occasionally, breast cancer diagnosis may follow an injury simply because the injury drew attention.
Yes. See, I knew that's where you were going.
So there's a situation that people may think that that injury may have caused the lump, um, and it's you know in some cases is not, but because of the injury, you go get checked out, and
Yeah. So it's almost like a blessing that the injury happened because it
correct.
allowed the lumps that were there to actually be detected.
Right. And based on that scan, unfortunately, well, fortunate and unfortunately. Fortunately, you hope that there is no uh, cancerous cells develop there. But if they, unfortunately do find it, then the cancer was already there.
Right.
So if you have a scar tissue from a previous injury or have recently suffered a breast injury, let your doctor know prior to your next mammogram so it doesn't get confused, or at least they know then they would have to do a little bit deeper dive into that exam, right?
Yeah, yeah, that's a good suggestion. All right. Myth 5. Breast cancer is more common in women with bigger breasts. Fact. There is no connection between breast size and cancer risk, although it can sometimes be more challenging to examine larger breasts. Obesity and breast density, on the other hand, can both increase the risk of breast cancer. In addition, family history and lifestyle factors can also influence the odds of getting breast cancer. So, women with larger breasts are more likely to report back pain, but this is not a risk factor for breast cancer.
Facts. Yeah. Um, Heard a lot about that before. So here's another one that people talk about, and it's assuming sugar causes breast cancer. Hmm. Well, here's the fact, people. While sugar isn't known for its health benefits, or correction, while sugar isn't known for its health benefits, it does not cause breast cancer. Many doctors and health experts encourage patients to reduce or limit their sugar intake because it's an addictive and can contribute, well, it is addictive and contribute to mood swings, obesity, and illness. Weight gain and obesity, in particular, are risk factors in developing breast cancer and in many types of cancers and many other types of cancers. I'm sorry. However, sugar itself does not make cancer develop or help tumors grow, as some myths hypothesize. Oh, pronounce that for me.
Hypothesize.
Yeah, I'm getting tongue tied here. So, eating too much of any food can contribute to weight gain, obesity, and health issues, which can in turn increase breast cancer risk. But there is no direct link between sugar and breast cancer. Consuming sugar in moderation as part of a healthy diet does not cause breast cancer.
Thank you for saying that. Because I've heard so many people tell me sugar causes cancer.
Yeah. No, if anything is going to cause
Diabetes, maybe, but
yeah. Yeah.
I don't even think that's true.
Your A1C is going to be
Yeah,
right.
it doesn't help with that for sure.
Yeah.
So myth number 7 is I don't want to say it's funny, but I've seen it before, right? And basically the myth is carrying a phone in your bra can cause breast cancer. It's one of those things where why do they make women's pants without pockets? Right? You've seen that there's no pockets. So where are they going to put their keys and everything? And I've seen women all of a sudden pull a phone out from 1 second there's no phone, next second there's a phone. I'm like, where did that phone come from?
Oh, surprised.
Surprise. So fact, while carrying your cell phone in your bra may not be the most comfortable choice, it does not cause breast cancer. Studies on mobile phone signals have shown no link between phone use and cancer, though scientists continue to monitor cell signals for potential longer term impacts. You might also be pleased to know that brain and nervous system cancers have not changed in frequency, even as cell phone usage has ramped up among all age groups. Nevertheless, to prevent potential skin burns or other issues, it's ideal to keep your bra for its intended use and carry your mobile phone in a bag, purse, or pocket.
Yeah, man. I would say carry that in your pocket somewhere or in your purse. I don't think that's a good idea. And then, sometimes I mean, listen, I could tell you as I put my phone in my back pocket, you don't realize there's an app running and heats up the phone.
Heats up the phone, yeah. Yeah.
You don't want to get burned.
No.
No, it's a very sensitive area. So let's jump into myth number 8, right? So bras with underwire can cause breast cancer. Well, the fact is, no matter what type of bras do not cause cancer. So they say decades ago, there was a rumor that underwire bras restricted the lymph fluid of the breast.
Mm.
which could lead to breast cancer. And you guys do know what our lymph nodes in our bodies is used to. It's a drainage system
Hmm.
for our body, right? But there's no evidence to support that wearing an underwire bra or any type of clothing leads to breast cancer. There is also no evidence to support the idea that going braless reduces the risk of breast cancer. However, bras that do not fit well can cause discomfort and swelling. So that's why I say it was important to have a woman on here because she may be able to elaborate on something like that. Maybe we'll do a part two.
Yeah, we could. Maybe somebody will send emails in and say, "Yeah, I agree with you."
Yeah, I
You
mean, that'd
know?
be good. Listen, here's the reality, folks. We're just jumping right into, again, supporting the breast cancer awareness. So, we're sharing some of the myths and trying to disprove certain things that, do show up, right?
Yeah, that's important. All right, I'm going to go into myth 9 because I've heard this before, and I've seen on the pharmacy shelves where they sell these crystal um, antiperspirants that don't do anything, at least as far as I'm concerned, because you put them on and you still smell afterwards. But so the myth is antiperspirants and deodorants cause breast cancer.
Hmm.
Fact is, according to the American Cancer Society, there is no conclusive evidence linking the use of underarm antiperspirants or deodorants in the subsequent development of breast cancer. There are no strong
Yeah, that
epidemiologic
word.
studies or studies in people that link breast cancer risk and antiperspirant use. And there is very little scientific evidence to support this claim.
I mean, I can only imagine the scientists that, you know, take all these, market antiperspirants,
Hmm.
deodorants, and put it to the test, right?
Hmm.
So, I mean, it's a good thing at this point that there's no scientific evidence to support that kind of a claim. So this is the one that was briefly spoke about. So myth number 10: men do not get breast cancer. It affects women only. What's your first thought, Kev? Yay or nay?
Well, I mean, I know the answer now, but
Hmm.
since since men have breasts, we don't like to think about it that way. But since men have breasts, we have breast tissue. We don't have the underlying work to feed a baby,
Right.
but we have nipples, right? So if we have nipples, we got breasts. So if we got breasts, then maybe logically it would make sense that we could get breast cancer.
So let's just jump right into it, right? Men can get, I repeat that, men can get breast cancer too. So they say this year it's estimated that approximately 2,800 men will be diagnosed with breast cancer, and 530 of them have the potential of dying.
Wow, that's almost 25%.
So they say while this percentage is still small, men should also check themselves periodically by doing a breast self exam while in the shower and reporting any changes to their physicians. So they're saying breast cancer in men is usually detected as a hard lump underneath the nipple and the areola.
Hmm.
Men can carry a 19% higher mortality rate than women do, primarily because awareness among men is lower and men are less likely to assume a lump is breast cancer, leading to delays in seeking treatment. I told you we're knuckleheads.
You got me feeling myself now.
Yeah, I mean, we don't think of it, right? We
Yeah, yeah,
truly don't think of it.
right. Yeah, I mean, there's no attention on that, right? It's usually when you see breast cancer walks and all that kind of stuff, it's associated with women.
Right.
As it should be, but they're not the only ones that can get it.
Hmm. Yeah, but I mean, again, um, we fail to really think that this could affect us, and because we're knuckleheads and don't inspect it, we just kind of brush it off, right? We're thinking at this point, oh, that must have been when I was working out, or when I was grappling or lifting weights.
Something bit me.
Right.
Right.
Yeah. So, yeah. So it's going to take us right into the impact on men, right? So, all people, female and male, are born with breast cells and tissue. This means that even though males do not develop milk producing breasts, a man's breast cells and tissue can still develop cancer, leading to a male breast cancer diagnosis. Men can be diagnosed with breast cancer at any age, really, though it's typically more common in older males they're saying between 60 to 70 years old. The average male for a male breast cancer diagnosis is in the ballpark of, they say, 67 years old. Like female breast cancer in men begins as a growth of malignant cancerous cells in the breast tissue. If left undetected and or untreated, the malignant cells can continue to grow and multiply, eventually spreading to other areas of the breast tissue or into other structures or parts of the body. So we're saying the earliest in breast cancer in men diagnosed, the easier it is to treat, increasing male breast cancer survival rates. So, men, this could happen to you too. And we have to be careful. I mean, again, this is predominantly more, it happens in women. But look, they're just saying in just this year, there are, approximately 2,800 men will be diagnosed. And they're calculating that in those 2,800, 530 of them have the potential of passing.
Wow.
That's scary stuff, man. Scary stuff. So I know you started telling me about a story, something that you read.
Yeah, I read about this guy named Jim who's an avid supporter of this charity called Ride for Roswell. And he had been participating in it for 10 years and consistently was raising enough funds to be part of the Peloton event featuring top fundraisers. When he started, he did it out of a belief in the cause and wanting to support Roswell Park Comprehensive Cancer Center, where his wife Karen had been a department administrator for some time. Jim didn't have a family history of cancer, but he and some friends got a team together and raised $275. He was in his second year participating in the ride when a visit to a family practitioner brought up something unusual. Like, uh-oh. He said, "You're in great shape, except your nipple's a little inverted. I want you to go in for a mammogram." Now, can you imagine a man? You're a man. Now you're being told you need to get a mammogram. Um,
Yeah, I would be shocked.
yeah. So Jim recalled this story, and he said, "I went home to tell my wife, and she couldn't see anything. So we got in here to Roswell Park. We got the mammogram, and 3 days later, the day before the ride, they tell me I have stage 2 breast cancer."
Devastating.
The next morning, Jim woke up and participated in the ride. 2 weeks later, he had a radical mastectomy and 4 lymph nodes removed. Then went through 8 cycles of chemotherapy and 30 doses of radiation. He lost all of his hair and is now on a regular dose of tamoxifen, an estrogen blocking medication to help prevent a reoccurrence of the cancer. Today, Jim is back to his regular self, even using his 70th birthday party last year as a $4,000 fundraiser for the ride.
That's great.
But he has changed in one big way since his diagnosis. He's become a strong advocate of helping men understand that they too can get breast cancer. I tell a lot of my friends, I'll do it on a post on Facebook and say, this is what to look for. So far, 5 people he knows have gone with his advice and were diagnosed. They all had earlier stages than me, he said.
Wow.
So, explore the different. So that's the story that I have on Jim. I mean, imagine, healthy guy. He's doing these races. He goes for an annual checkup. His doctor says, "Hey, your nipple's inverted," and gets told to have a mammogram, and it ends up having stage 2 breast cancer.
So let's talk about what things you can do, really, right? So regular self exams, annual checkups, and mammograms for both men and women. Obviously, I would go with, speaking to your physician and see what his recommendations are and whether he recommends it, right? I mean, a lot of the self tests you could do, but obviously always consult with your doctor.
Mhm.
We want to discuss how to reduce the risk factors, right? Exercise regularly, maintain a healthy weight, limit alcohol consumption, avoid tobacco use. So those are a couple things that you could really sit there and uh, try to do to reduce those symptoms. And again, early detection is the key.
Yeah.
Staying on top of it helps. Um, making sure that you know what's going on with your body. So let's what else you got for me, Kev?
All right. So let's, I guess that wraps up to get us to our conclusion. So I want to emphasize the symptoms of breast cancer in men and women. So lump or thickening in or near the breast, changes in the size or shape of the breast, dimple or puckering on the breast skin, like Jim, who had a nipple turned inward, nipple discharge, or changes to the appearance of areola or breast skin. I think that brings us to our conclusion here. Now, I want to say that these facts I got from different sources, and you can go to look for yourself as well. Make sure you educate yourself on this, men and women. So, some of the stuff I got from the American Cancer Society website, which is at cancer.org, the National Breast Cancer Foundation, which is nbcf.org, and the Male Breast Cancer Coalition, which is malebreastcancercoalition.com. I'm going to make sure that I put links to all of this on our website at sipandsayit.com. And I'll put links to any type of things I think you should read and download in this for this particular situation, because breast cancer is serious and it's something that men and women and children can suffer from. So the more we know, the better off we are.
Yeah, and it shouldn't take for October to be the breast cancer awareness month. I think that's something that we should all kind of follow through as we do our routine checks. And we all have, those annual checks that we go through with our physician to, check every, you know, part in your body. This is almost like, I almost want to describe it. You're going to go buy a car, right? And you got to go, make sure that everything is operational. Make sure windows are opening and closing, turn signals, headlights, all that stuff. And ultimately, you going to the doctor, doing your annual, you're getting blood work, any aches and pains, vision, hearing, smelling, tasting, you getting your panels. Again, they talked about sugar, getting getting your A1C checked,
Mhm.
um, all that stuff, man. Like it shouldn't take a month I understand the purpose of the tribute to it, but we should all be taking care of ourselves. And I always say before I open my mouth about anything that I always going to start with myself. I am one of those hard heads, and I'm recognizing that the older we get, the more our bodies are changing, and you know we're not those spring chickens anymore, Kev.
No, this weekend made me realize that.
Yeah, yeah, definitely. And then, more importantly, for men, again, we just touched that base. Is the mindset is always that it's women, 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 women. As we see, men could also have cancerous cells in our breast tissue. So, folks, as always, thank you for participating and listening to Sip and Say It. Um, Our hope is with this PSA, is to continue the support of bringing awareness out. I hope that you got to enjoy a little bit of what we spoke about. Please do us a favor and reach out to us at Sip and Say It podcast at gmail.com. Kev?
Or info@sipandsayit.com.
Yeah, definitely your input and your thoughts on some of these episodes that we're laying out. Please bring it in. And if you have any suggestions, send them through through our email, and we'll prepare for the next one. And just like we finish every episode, let's sip and say it together. Thank you, folks.
Peace.
On behalf of your host, Los, thank you for joining us this week on Sip and Say It. Without you, the village, and the participation on Sip and Say It, the universe will never know what's on your mind. Subscribe to Sip and Say It on media platforms like Spotify, Amazon Music, Apple Music, YouTube, iHeartRadio, Pocket Cast, and our very own Facebook page at Sip and Say It. Email us with your thoughts about the episode or topics you'd like to hear to be discussed at sipandsayitpodcast@gmail.com. Tune in next for our next episode. We can sip and say it together.